Well, good evening, party people. Whether you are enjoying the gifted champagne you received or a beverage of your choice, I say let's raise our glasses and toast to being together for the launch of Reach Out and Read expansion in Kent County. So here we go. We've got water. Thank you. If anyone put your favorite children's book name in the chat, please go ahead and do that if you haven't. And at the intermission, we will be drawing a name for a gift box midway through our time. So this is a party, but it actually is a serious party because, as you know, we in West Michigan and across the US have a problem. Many of our kids aren't starting school with the basic early literacy and social emotional skills they need to be confident and ready for school. But we know the science, and neuroscience reveals that the most critical time for brain growth and healthy development is the first 5 years of life. But we know also that policy and structures haven't been in place to ensure that we have the right start and the right things in place needed for that healthy development. So that brings us here tonight. We are doing something to help with brain building from the very beginning. Because of Kent County citizen support of First Steps Kent and the Ready by 5 early childhood millage, Reach Out and Read, the evidence-based model linking early literacy and health, has the opportunity to serve 23,000 Kent County children, which doubles the number that are being served today. Coming alongside us on this journey is Cherry Health, a longtime Reach Out and Read champion and leader of building Reach Out and Read home libraries. This is a key equity builder in healthcare. The pandemics are laying bare the realities of health inequities. And over the last 8 months, Reach Out and Read providers are telling us that sharing books as a diagnostic and intervention tool helps to mitigate against those inequity drivers. Literacy practices, daily routines, and home bonding moments are being reinforced. So, a Reach Out and Read champion, Dr. Mona Hanna-Attisha, has added tools to her black bag, or Mona, your white coat pockets. And these tools are books, and they are changing pediatric care in a powerful way. In Mona's practice since residency, in her pedagogy as a medical educator, and as a community mobilizer now leading the way to bring evidence-based, cost-effective practices to Flint kids, Reach Out and Read has been helpful. In addition to being USA Today's Woman of the Century, Mona Hanna-Attisha is an avid reader and storyteller. We know that stories shape what we believe about ourselves, our peers, and our world, and the story Dr. Mona is leading and living is one of crisis and hope for kids and communities. As a pediatrician, she has championed expanding reading and books in pediatric care through Reach Out and Read because she knows the data about reading and how to offer language-rich experiences starting from birth. Dr. Mona, I think I speak for everyone when I thank you for coming to Kent County. Welcome.
Thank you. I'm so excited to be here with all these Briannas. This is amazing. Thank you.
Awesome. Thanks for your grace in this. For everybody at home, please know that we are all part of this discussion. So feel free to add your thoughts or questions to the chat box, and then we'll share at the end of my discussion with Mona. So Mona, I have a few questions for you, and I will start. In your book, What the Eyes Don't See, you say that the Flint-led crisis is also a story about how we came together. So in crisis, we tend to run from each other or come together. Could you tell us about the power of bringing people together from different backgrounds for a unified mission?
Absolutely, Donna. That's a great question. And I just want to say thank you for having me be part of this party, this launch, this kickoff. It is amazing what you are doing. The Millage and Kent County supporting our youngest kids is a model. It is phenomenal. Kudos to all of you. I'm so excited for the work that you're doing. And I can't wait for us to copy the things that you do. So congratulations to the organizers, and congratulations to all the attendees that are going to be part of this really instrumental, critical, brain-changing, trajectory altering work. So kudos to everybody. So your question was about bringing people together during times of crisis. So my story was about a different public health crisis, but a public health crisis that has some of the same lessons that we're all living through right now in this current pandemic, this current preventable public health crisis. So, what we learned in Flint during our public health crisis was that, hey, you need good leaders that value public health, and you need to respect science, and you have to have this robust investment over time in public health infrastructure. And we have to recognize disparities because they only worsen with crises. And so when our crisis happened, there was an opportunity for folks to kind of close their eyes and to run the other way and say, I don't want to have anything part of this. But what I loved about working in Flint, and what I love about working in Flint, and what I love about being part of a crisis is that a crisis is actually a time where people do come together. For me, a crisis is an opportunity. And we absolutely realized that in Flint. When our crisis unfolded, when we realized the scope of what could happen and may continue to happen to the potential of our children, we were a city that came together and rolled up their sleeves and got to work on behalf of our children. So in some ways, it was this, people have been working on literacy for a long time. They've been working on nutrition. They've been working on poverty. They've been working on racism. But when this crisis happened, it pushed us all together into the same rooms and the same tables. Mm-hmm. And it gave us a sense of urgency to work together, and to work together with folks that we're not used to working together. Mm-hmm. So, Don and I were pediatricians, doctors. We usually hang out with other doctors. And for so long, I used to hang out with lots of other academics, lots of doctors. And I go to conferences with lots of doctors, and we tend to kind of really silo ourselves. But in work like this, around our children, around literacy, around a time of crisis, we really learned to expand the tent and to work with folks from different sectors and different disciplines. And I think that's why our work has been so successful. Because, hey, you know what? Engineers care about kids, and librarians and teachers and social workers and faith leaders and government officials. So many other folks also care about our children. And we have to kind of break down those barriers and work together as much as possible. So I think that's one thing that I definitely learned in our crisis, that a crisis can be an opportunity, and that we need to absolutely seize that opportunity and holistically look at what our kids need.
Thank you so much. Excellent reflections. On a lighter note, I've seen your kindergarten picture, and you were at the front of the class and it looked like you were talking. Do you remember a time when you were hesitant to speak out, but you found the courage to use your voice? I'd love to hear a reflection.
Yeah, so that kindergarten picture is in my book, and it's actually when I started kindergarten in the Upper Peninsula of Michigan. So when my family and I immigrated to this country, I was about 4 or 5 years old, and of all places, we landed in the UP of Michigan, which is crazy cold, but we were warmed by the tight-knit community of folks while we were there. So I was, standing up in front of the class, raising my hand. I've always gotten in trouble for speaking too much, and was told to always be quiet. But fortunately, I was always blessed with so many teachers and mentors and colleagues and other folks who thought I had something to say and didn't tell me to be quiet, and valued the diversity that I brought to the table, and valued kind of my voice also as a woman of color. So I have been kind of blessed to, sure, I had those, many a times, especially as a kid, especially when there was international news of something going on in the Middle East, I'd get, called on, like, oh, you're a terrorist, go back to where you came from, what have you. So that was definitely part of growing up as an immigrant. But I also, as a kid, when I grew up, my diversity, it was different than it is now. Being an immigrant was a little more celebrated. Lady Liberty at that time, her arms were open a little wider than they are now. So because of that climate, and because of, I think, kind of the value system in my home environment, I was able to grow up competent and confident in my own voice, and was taught from a young age that it is your job to raise your voice. And this was passed on through storytelling. And that is why I love books. I mean, I grew up as a reader. I literally grew up in my city library. I can still smell the library. We would spend every weekend in our library. Like, reading was like the religion of our family, but also through oral history. So a lot of storytelling of family members, who also, the lessons were that they stood up and they spoke up because it was the right thing to do. And I'll quickly share one story that I was embedded in me since I was a child. And it's a story of my great uncle Nuri. And in the 1930s, he found his way from Iraq, which is where we're originally from, to Spain to fight in the Spanish Civil War as part of the International Brigades. So this was this international movement against fascism and Franco and the beginning of World War II. He had started a group called the Association Against Imperialism and Fascism. So, like, I think I would join that group now. But anyways, my great uncle was always doing these things because it was easy, and not because, like, it had no risk to it. He was doing things that were hard, but because they were right things to do. So he was raising his voice. He was standing up for these big issues of freedom and justice and democracy, and speaking up for the most vulnerable. And those were the stories, not only in literature, but through family history, that was embedded in me when I was a child. So that gave me also the confidence, that love of the humanities and the kind of these personal family stories, to realize that that's also my duty, no matter my profession, no matter where I am, no matter where I find myself, that I have this amazing privilege to use my voice for good.
Powerful. The environments that we create so kids are willing to use their voices and don't feel shut out is huge. So, well, I've really been taken by your book when it first came out, and I'd like to read a passage from the book. It outlines a pivotal moment, a call to action, and ultimately the uncovering of the Flint water crisis. But it's in the context of your friendship and your friendship with Ellen, I believe. So on page 46, you're having a conversation with Ellen in your backyard. She was a leading epidemiologist with the EPA, and she knew a lot about lead in kids because of the lead crisis in DC a decade earlier. And she said on page 46, there was a demand for proof of impact, like researchers couldn't draw the link between increased lead levels in water and impact on kids. No link, no traction. Ellen said, no link, no action, just a lot of stalling and nothing. Then you say, then my friend said, Mona, listen to me. You can do this. Would you take us back to that moment?
That's a great scene and a great memory. So my involvement in the Flint water crisis did not happen as a pediatrician seeing patients who had acute symptoms of lead poisoning. That's not how kids with lead usually present. It's asymptomatic. It's known as a silent pediatric epidemic. But I was clued into the possibility of lead in our water from hanging out with my high school girlfriend in my backyard at a last minute barbecue. So this speaks the power of hanging out with girlfriends, of staying connected to a network, of making friends once again with folks who are different than you. So in my house, is when she disclosed, or when she shared, hey, Mona, the water in Flint's not being treated properly. And because it's not being treated properly, there's a potential of lead being in the water. And that is the exact moment, and the date, the time, that is the exact moment that my life changed. When I heard about the possibility of lead being in the water. And I think that's what anybody in my shoes would have done. Any physician, anybody with any kind of knowledge of public health respects the science of what lead does. It's like, it's really, really bad. And we've known that it's bad for centuries. If you could think of something to purposely put into a population down, it would be lead. It's the source of so many of our inequities, our long-standing inequities. So I respect that science of lead. I respect and understand that it's a form of, environmental injustice, environmental racism. And when she told me about the possibility of lead in the water, there was no, I'm going to close my eyes and go back to being a regular pediatrician, academic. It was only going forward. And I knew that the only way to go forward was to see if kids were in harm's way. And I want to kind of pause there, because that whole sentence about no traction, no action, no link, like I had to set out to prove that lead was in the body of our children. And I should never have to have done that. There's, what happened in Flint obviously never should have happened, but it should have ended when that first mom in Flint raised a jug of brown water and said, there's something wrong with my water.
Yeah.
And that's why Flint is such a case of environmental injustice, because the people of Flint who knew in their gut that something was wrong, this predominantly poor, predominantly minority community, were being dismissed and denied. It shouldn't take scientists to prove harm before we take action to prevent injury, especially for our children. It goes against everything that governs us in public health, which is how we should be driven, which is by this concept called the precautionary principle, where we try to prevent harm from happening in the first place, rather than only taking action when we see harm. It's anti-science, it's anti-common sense, especially when you recognize that there's no safe level of lead at all. So once again, that was the moment that changed my life, when I heard there was lead in the water, because I respected the science, and because, as a physician, I have literally taken an oath to protect children. Like, part of my job is, I'm a researcher, I'm a clinician, I'm an educator, but I'm also an advocate. That's one of the reasons I went into this profession. My job as a pediatrician isn't so much about making sure that kid in front of me today is healthy, but just like all of you, it is about the potential of our children. It is about making sure that their tomorrow is as bright as possible. Yet there was something in our water that was literally threatening the tomorrow of not just one child, but of a population of children. So that's kind of when I stopped eating, when I started to live on coffee, when I lost 30 pounds, and kind of started that work to uncover what was happening in the bodies of our children, which once again, I never should have had to do. It's entirely preventable.
Well, that time and place has changed the trajectory, and I'm glad you had your ears and eyes wide open, and that your friendship really carried you into that time of action. As you've advocated for clean water, you have really gone to great lengths to talk about other injustices, and the injustices of lack of education, racism, not adequate primary or secondary prevention. Could you talk about kind of the intersection of the issues that lead to health inequality?
Oh, that's a wonderful question. Thank you. So when the water crisis kind of unfolded and we realized that we have this population level exposure to a neurotoxin, which is bad and irreversible and you can't take away, there came a moment that I'm like, oh my gosh, like I wish I could just like prescribe something to take this away. Like, is there like a cure or an antidote or something I can give my patients to take this away? And I quickly realized, no, Mona, there's not something that can take this away. There's no like rewind button. So then we went back to the science. Like, what is the science of what children need? And we holistically framed the crisis as one added trauma to a population already rattled with so much trauma, so many
Right.
toxicities, not just environmental, exposure, but also longstanding poverty. We have about a near 60% child poverty rate in Flint. Longstanding racism, longstanding income inequality. We have no full service grocery stores in Flint. One of the highest unemployment rates, in the state. Violent crime, lack of safe places to put. Like the list goes on of all these
Mhm.
other social determinants of health that impact the life course trajectory of children. So, a lot of us out there understand that medicine alone only contributes to about 10 to 20% of healthcare outcomes.
Right.
That's it. There's only, it's not, I can't prescribe you an antibiotic to take away the fact that you don't have a house, or you don't have access to books, or you don't
Mhm.
know where you're going to get your next meal. So all of these things are intimately related. And that's why, in my book and in our work, we have to work in the intersections of all these spaces. We can't just address literacy without also, considering, longstanding racism and income inequality and the poverty and all these other things that also play a huge role in the lives of our children. So when we were able to frame this crisis in Flint as an added toxicity, as an added trauma
Yeah.
to longstanding and chronic traumas, then we went back to the science of what do kids need? Like, how do we support
Mhm.
children and families? And how do we not just put the burden on children and families who are already so impacted? Like, we don't want them to just do more, like sign up for more programs and read more books to your kids and do all this and this and this. Like, how can we also take a step back and build resilient communities, not just resilient children, but how do we build more resilient communities? How do we bring in more living wage jobs?
Yeah.
How do we make sure that we have more mixed housing complexes? How do we make sure that the homes that people are living in are safe and healthy? How do we make sure that your water is clean and your air, you can breathe the air in your community? So also taking a step back and looking at these policy level, community level interventions. It's been said that pediatricians are the ultimate witnesses to failed social policies. And, I can attest to that in Flint. I think many docs out there can also attest to that because, it's in our exam rooms and in our hospital beds that we see the consequences of really a longstanding failure to invest in what keeps our children healthy and successful.
Well, as a part of this, you just don't think about books and medicine, right? But you have called Reach Out and Read a cornerstone to rebuilding and recovery in Flint. Tell us about Reach Out and Read and how that's played out in your leadership.
Oh, I'm so happy to. And I'm like getting really excited right now just thinking and talking about it. So ever since I was a trainee, a pediatric resident, like 20-ish years ago, like even back then we knew about the evidence base of Reach Out and Read. Like it was basic common sense. This is what you do in practices. And even back then, and even increasingly more so now, we understand the evidence base of Reach Out and Read, why it just makes so much sense, and how it improves the development of children, and how when it's part of practices and part of a prescription and a part of what a doctor does, it has, it's the uptake is greater. So I kind of assumed that everybody was doing Reach Out and Read. Like, yeah, like we did it in our practice in Flint at Hurley. We're the largest pediatric practice with the academic center. So we do that and all the other hundreds of things that you're supposed to do. And thus our visits are like 5 hours long. But anyways, like we do what we're supposed to do. And I was assuming that every practice in our community was also participating in Reach Out and Read. And then there was this sense of urgency, like, oh my gosh, we had a population level exposure to a neurotoxin that might implicate the development of our children, in this kind of list of things that we want to put into place to support the development of our children. Obviously, let's lean on the evidence, the science of what works, and Reach Out and Read came to the top of that list. So then we started to do kind of a scan of the community to see like who else is doing Reach Out and Read. And my jaw dropped when I realized that, oh my gosh, there were no other practices in our county that were doing Reach Out and Read. And that was shocking to me. So in the last 3 or 4 years since then, we've hired a Reach Out and Read coordinator. She's a former pediatric nurse who knows all the pediatricians in the community. And we've gone from one clinic that's part of Reach Out and Read to now 15 clinics in Genesee County that do Reach Out and Read. Through grant funding, we've been able to supply every clinic with 3 years of books. We handhold them through their certification and all the training that they have to do, and make sure that their scholastic accounts are also robust. So Reach Out and Read is one of the most important programs that we're doing. It's also one of several other early literacy programs. I received a small grant in 2016, which launched something called Flint Kids Read. So, and we put together around a table, just like I'm sure you have, all the people who care about early literacy. And it was our library and our ISD, our school district, and the healthcare community, and the pediatricians, and our early literacy network. And we started to brainstorm, like, what else can we do besides Reach Out and Read? So we signed up for the Imagination Library program. Dolly Parton is, I think, everybody's hero. Not only does she fund like COVID vaccines, but she's also done tremendous work around early literacy. So now kids in Flint get home delivery of books every month from the age of 0 to 5, which, as you can imagine, during the pandemic was really the only thing kids were getting in terms of enrichment. So another kudos to our postal service there for delivering books to our children. About 150,000 books have been mailed to Flint children through the Imagination Library program. Over 50,000 books have been given out through Reach Out and Read. We also started something called Born to Read, which is at our newborn nursery. Babies get a bundle of books. They get signed up for these programs and developmental tools. And we also understand that kids don't live in a vacuum. So with our partners, we're addressing 2-generation and 3-generation literacy efforts, because we know that a lot of parents and grandparents also struggle with literacy. Mm-hmm. So Reach Out and Read was the nexus of all of this. And we are so grateful to be able to expand it so that every practice out there recognizes that you have to do this. You develop developmental screening, you check growth, and you check kids' hearing, and you are part of Reach Out and Read. This is standard, and just like you guys, we're trying to make it so.
Yeah, that's great. It's often, kind of the lead in with families. That I just see dollar signs too, from the standpoint of the cost of that primary and secondary prevention. But kudos for leading the way. Want to switch a little to talk about policy. So I've heard you say that policy decisions don't look at the implications for the next generation, let alone the kids today, right? We're always putting Band-Aids on things. 2 minutes, what policy would you prioritize right now?
So we absolutely, at the policy level, the state and national level, have not prioritized children at all. When you take a step back, and this is what keeps me up at night, it's as if we're at war with our children. We constantly are defending cuts from Medicaid and SNAP and WIC and CHIP and all these critical things that children need. We're struggling to get more dollars for Head Start and Early Head Start. And the list goes on. Our inaction on climate change and gun violence, all these things threaten children, and they're all done at a policy level. Not just policies, but our lack of policies also hurt kids. If there is one thing that I would do at a policy level, it would be universal, free, high quality early childhood education. 0 to 5, every single kid gets a free, high quality childhood education. It also puts families back to work. It's also a poverty mitigator, and it is during that most critical window of early childhood development.
How are we doing on time? I want a time check here. We good? One more question? All right.
Donna, I want to talk about, you said dollars, and it scared you, that all these things cost dollars. And I also want to say that there's a huge return on investment on doing this work. When we put a child through early childhood education, There's a lot of literature out there, but some show up to a 14-to-1 return on investment. A lot of that research came out of Michigan too, with the Perry Preschool Project in Ypsilanti, which kind of created a lot of the robust work we have in Head Start and early Head Start. So even though this might have upfront costs, there is longitudinal societal savings, not just for literacy, but all of this investment that we're doing in early childhood. And at the policy level, we are so short-sighted. We only look at, oh, well, what's going to happen in 2 years? What's going to happen in 5 years? And unfortunately, we don't look at what's going to happen in 20 years or in 30 years for the life course of that child.
You know, Dr. Mona, the U.S. Chamber put out they did a meta-analysis last year. I'm sure you've seen that, right? Looking at all the papers on Heckman's return on investment, his long-term data. And they said for every $1 that is invested in high quality early learning, it's up to $16 back in the pockets of people in the community. So there's the reality. Economists are looking at it. Certainly, Mr. Rogers was shouting it from the rooftops or whispering it from the rooftops from here, but Raj Chetty, David Brooks, everybody is talking about the return on investment. So we just got to keep saying it, and people are taking notice.
Yes,
so
I agree.
Using your voice, I would love to hear your final words before we transition to bring other people into the conversation.
You know, we're at this kind of generation defining moment of crisis right now in our nation. And like I said earlier, that makes me happy, that inspires me, because that gives us an opportunity to change, to reimagine. We cannot go back to how it was, because how it wasn't working for so many people. This is our time to reimagine what it can look like for our children, where we value science, where we respect their development, where we work to eliminate inequities. So I hope you kind of join in this excitement with me, that we are at this kind of pivotal moment of opportunity. We shouldn't be sitting at the sidelines. We should all be engaged, keep holding folks accountable, and keep working to make things like early childhood and the funding for these programs realized.
Thank you so much, Dr. Mona.
Okay, well, we are back and ready to make it feel like a party. So in the spirit of that, I'm wondering if you all have your champagne at home. We're ready to make another cheers to having fun while solving challenging problems.
Here.
So right after that, we want to do something a little fun. We put everyone's name in a little raffle wheel, and we're going to draw a winner for a gift box. So technology is really fun tonight, so I'm going to do it here and then show you all at home. So I'm spinning. Here we go. Our winner is Maureen Hale. So Maureen, if you could just put do not use the chat, Maureen. We will get in touch with you after this evening, and we will get your gift box sent to you. So thank you to everyone joining us this evening for the launch of the Kent County Healthcare Collaborative. As we reviewed what is important, as well as what we wanted to communicate, we selected our guests very specifically. Joining us tonight is a group of accomplished, caring, informed, and empathetic individuals who represent various perspectives on how Reach Out and Read is addressing the problem we stated earlier, that many of our children are not starting school with the basic early literacy and social emotional skills they so desperately need to be confident and ready for school. Please join me in welcoming Tasha Blackmon. She is the president and CEO of Cherry Health, which is a federally qualified health center. Cherry Health and Tasha bring us a hyper-local perspective as their home base is right here in Kent County. Representing the regional and state perspective is Dr. Mona Hanna-Attisha. As we learned earlier, she is a pediatrician and professor, author, and public health expert. Coming to us all the way from Minnesota and offering a national viewpoint is Dr. Nate Chomelo. He is a pediatrician and internal medicine hospitalist, the medical director for the state of Minnesota's Medicaid program, and is the former Reach Out and Read Minnesota medical director. Lastly, representing the community and early childhood perspective, you've already met Dr. Donna Lowry. She is an OBGYN turned president and CEO of Ready for School and the medical director of Reach Out and Read West Michigan. In addition to having healthcare, children, and communities in common, these panelists are all advocates of Reach Out and Read. Without further ado, I'd like to begin. This question is for all of our panelists. Can you tell us about your favorite book, character, or memory, and what made it special? Tasha, we'll start with you.
Absolutely. So, my favorite book as a child was The Snowy Day by Ezra Jack Keats. And what was really fascinating about that particular book was that I had never seen a Black kid featured in a book as the main character of a story until that point. So what I loved most about that book was Peter's curiosity, as well as his easy breezy attitude about the snow. The simplicity of the book to me is what makes it timeless.
I'm so sorry to interrupt, Tasha. We can't hear you.
You can't hear me at all?
Yes. Now we can hear you.
You can't hear me now?
It's a little bit muffled.
Okay, you cannot hear me now?
Just speak louder.
Can you hear me?
That's better.
Okay. Does it feel like I'm yelling? Because it feels like I'm yelling to me.
Can you try one more time, Tasha?
Can you hear me now?
We can hear you a little bit better, yes.
Okay, so I'm doing everything on my end. But my favorite book was Snowy Day by Ezra Jack Keats. And one of the things I really enjoyed about the book is, one, it was the first book I had ever read that had kids that looked like me, a Black kid on the cover and as the main character. And what I loved most about it was Peter's curiosity, as well as his easy, breezy attitude about the snow. And the simplicity of the book is what makes it timeless. So that's my favorite book.
Dr. Mona, would you like to go next?
Yes, can you hear me okay? Okay, so my favorite book is written by another doctor, Dr. Seuss, and it is The Lorax. And I actually quote The Lorax in the beginning of my book, and my favorite line in there is, unless someone like you cares a whole awful lot, nothing is going to get better, it's not. So those are words that I've tried to live by, and words that I try to impart, especially with my learners and young people, that if you care about something, you got to speak up, you got to stand up, because if you don't, there's not somebody else who's going to do it for you.
So true. Dr. Nate, how about you?
A lot to choose from, but I think the one that's still closest to me right now is On the Night You Were Born by Nancy Tillman. And this is pretty special for me. My son arrived after my wife and I were trying for 4 years, and then her water broke at 25 weeks, and then he came at 30 weeks. And so we read this on that first night that he arrived, and it really helped just kind of celebrate and help with our own anxiety. And then we read it every month on the day that he was born, on the 6th. For the first year of his life. And so I think it's just a kind of a reminder to how much he's grown and done well from there, and how reading's been a part of that.
Fantastic. Thank you. Donna, how about you?
I loved a book called Katie No Pocket. I don't know the author, but it was about a kangaroo who didn't have a pocket. And so that's really frustrating if you have a Joey and you don't have a place to keep the baby. So I think it probably inspired me to become an OBGYN, but ultimately her community of friends gave her an apron with like 16 pockets. So all of the neighborhood kangaroos ended up taking her as a mother. So there's some analogy in there for my life, I think.
I love that. Thank you all for sharing. Next, we're going to go to Dr. Nate. Dr. Nate, as the former director of Minnesota's Reach Out and Read program, will you share with us your elevator pitch for Reach Out and Read?
Yeah, I'd be happy to. And I think it's really just building off of, the great introduction that Dr. Mona provided earlier in her comments. However, but when I'm talking about Reach Out and Read, I usually start by saying, it's a program that's been in existence for now 31 years. It was started by pediatricians and social workers in Boston who, first realized that a lot of their children, when they were going to school, that they were seeing in clinic, didn't have a lot of the skills ready to succeed. They didn't know all their letters. They didn't know how to hold a book correctly, even in some cases. And so they thought just getting books into their hands and into their lobbies would be a good way to help. And those books started disappearing from the lobbies as the families would take them home. And so they said, let's design an actual intervention in a model and actually study it. And what's the impact of, doctors giving books to kids at their visits. And from that, it grew to an intervention that has an evidence base that shows that children and families that participate in Reach Out and Read clinics are more likely to enjoy reading and list it as one of their favorite activities as a family. They're more likely to read every day at home. They do better on vocabulary tests at 18 months and 24 months of age. And it's been shown to be a buffer against toxic stress, both for the children and the parents. And we see some of the benefits the most in some of our children who are the most under-resourced, those from low-income families, those from minority families. And so it's a really low-cost intervention. It uses a trusted messenger in the physician and that relationship between the physician and the family to deliver an important message. And it can be done in a way that's culturally appropriate, and the books are given in a developmentally appropriate way at each visit between anywhere from birth to 5 years of age. And so really it's just a meeting families where they are at, and it's kind of a perfect blend of what we can bring in healthcare, and as Dr. Mona touched upon, impact the trajectory of our children's lives. And so I like to say, giving them the book gives them the ability to start to be able to write their own story.
Thank you. I would love to be on that elevator when you tell someone that, because there could never be a way anyone could not hop on board, Reach Out and Read once they hear that from you. This next question is one for the whole panel. Please tell us a story or interaction you had where Reach Out and Read was a useful engagement strategy. Dr. Mona, will you answer first?
Yeah, so less than a month ago, I was in clinic. And at the end of every clinic visit, I usually ask the child or the parent, depending on the age of the child, like, do you have any questions? Like, is there anything else, that you need? Any questions? And the kid was about 6, and he looked at me, and I'm like, yeah, what's your question? And he asked, where do carrots come from? And I'm like, oh, a resident with me and a medical student with me, and there was lots of patients waiting. Actually, I don't think there was lots of patients waiting. We're still really slow because of COVID. So I'm like, oh, where do carrots come from? So I spend about 15 minutes talking where carrots come from. And I'm like, oh my gosh, we have books. So I went back to our kind of storage shelf of all our Reach Out and Read books, and I picked several. Sometimes I cheat and I give more than one book to a child. And I got him a bunny rabbit book and another book about eating a rainbow and what have you. And then we kind of looked at the book together, and we turned the pages, and his little brother started eating the book, and that was all awesome. So this is just one recent example of being able to use Reach Out and Read with a whole family to encourage reading and to help satisfy the amazing curiosity of our children whose question was, where do carrots come from? Like, isn't it awesome? Like, we have the best job in the world. Like, we get to talk to kids about where carrots come from, and then we get to show them beautiful books that help explain it better with bunny rabbits.
Oh, I love that. Tasha, how about you? Do you have a story from your providers that you can share with us?
So what I would say is that Reach Out and Read has just been a useful re-engagement strategy for all of our providers and for the patients as well. And part of the way that we've used the program is to really allow parents and children to develop a strong rapport with their pediatrician. And through that kind of gift of a book, there's trust that's built. And then, our kids, they actually look forward to receiving the book. And one of the great things about that is it sets them on a trajectory to see the value in actually visiting their doctor. So there's some value in that even. And if you have to do that through encouraging them with a book, that's even better. So all of our providers just can't say anything but positive and encouraging stories about the interaction that they've had with families. So I don't have one specific story, but I can just say that the program has been outstanding here at Cherry Health, and we don't know actually what we would do without it.
That's a really great point, Tasha. Our next question is very, very similar to this because we know that the trust is central to the patient, family, and provider relationships, similar to exactly what you just mentioned. What are all of you and your practices currently hearing from families as their main concerns in such a time as right now? And how do you think Reach Out and Read is mitigating some of those concerns?
Me specifically?
Yeah, we'll start with you and then we'll open it up to Dr. Mona, Dr. Nate, and Donna.
So the concerns that we're hearing from our patients, they really mirror some of the concerns that others are hearing, especially given COVID and this day and time that we're all dealing with. I mean, they're worried about the impact of all of the social injustices, of the racism that has occurred, as well as just the fear of the ongoing pandemic. So with the pressures of homeschooling, some parents are even concerned about their children falling behind. So one way that we've been able to mitigate some of these concerns is through embedding literacy into our pediatric visits and across the continuum. We're encouraging parents to read to their children from the very beginning, from birth. And this really enhances the bonding experience between parents and their children while prioritizing literacy, like I said, from the very beginning. Now, through our Reach Out and Read program, we go to the next step in ensuring that the books that our children receive are accurate and are diverse representations of maybe that child's personal experience. So it's going to be ethnically and culturally appropriate for that individual. I can just speak to the benefit of seeing myself in, Peter. That is a powerful thing to see yourself in, a character in a book. It inspires imagination. It provides an escape to what you may be going through in your life personally. But it also does something else that I think is important to share. When a kid receives a book from Cherry Health and from a pediatrician like, let's say, Dr. Bush or Dr. Stout, that their parents respect and have a lot of trust in, it shows our families that we see them. It shows our families that we acknowledge the ways that they experience life and that they experience the world. So, having those culturally relevant books, I think, has really added a tremendous amount of value to what we do. And I think it's also helped our providers to understand that cultural competency is, it goes beyond just the doctor's office. Understanding someone's lived experience is critical to eventually getting them to a place of health literacy.
I would echo what Tasha said. That yeah, that was phenomenal. You know, we also in our Reach Out and Read work have spent a lot of effort making sure that our books are representative of the population that we are privileged to serve. We have also been able to support local authors who've written books. We have bought the books Hair Like Me, Skin Like Me. All of our other books are either brown or black characters or they're animals. So we really want to scale very early on in what children are exposed to, so they can see themselves in the books that they get from us. So that's been really a thoughtful part of our decision making as well in Reach Out and Read. We've also been able to partner with First Book, and that First Book, that's part of their mission too, is making sure that kids have diverse characters in their books. So, you know, Tasha kind of touched on everything that our patients are going through in this pandemic. It's been very, very hard. It's been hard, especially for our most vulnerable populations. And it's on top of, once again, so much pre-existing trauma and toxicity that our communities are already faced with. We've been able to do some qualitative evaluation of some of the services in our clinic. And this is a quote from one of our parents who said, something like, you know, when we come to your clinic, you don't give us a sucker, you give us a book. And that tells us that you really care about us, like you really care about like the development and the success of our children. You're not just giving them candy, you're giving them something that's going to help them. And I think that really speaks to the relationship and the almost the halo effect of Reach Out and Read has had on the whole quality of care in our delivery system. Because we do this one thing, it's really made others think that everything that we do, which it is also for their best interest.
And I'll just add and echo everything that Tasha and Dr. Mona just said there, but add that the evidence backs that up. That providers actually enjoy participating in Well Child Checks More when they're in a Reach Out and Read clinic, and that families have higher ratings of their pediatricians or their family practice providers when they participate in Reach Out and Read. And certainly from my practice, I've been seeing very much the same. It's just the stress levels are through the roof. They're higher than at any point in my now 11-year career as a physician. You walk into rooms and you can just feel it in a way that you couldn't before. And so what Reach Out and Read does is it does give you a moment to kind of cut through that and kind of let's all look at the child and how beautiful the child is and how much joy there is in getting this book and this special gift, and how they interact with their sibling or their caregiver in that moment. And we know from the evidence that, again, it helps buffer against toxic stress, right? It helps buffer against the stress that the children are facing. It helps parents with their own anxiety and their confidence around parenting. There was even this really interesting study done about giving books to children who had just suffered a hurricane in the Philippines. And they showed that there was evidence that the children that got books in that kind of recovery period actually did better or had a little more tools in their resiliency kits as far as how they're able to manage afterwards 1 year later after going through that traumatic experience of hurricane. And you can kind of really imagine that COVID-19 has been this 9, 10, 11-month hurricane that we're all going through. And so I think Reach Out and Read is, it's not going to be the be all end all, but it is one of those tools that we can provide to help us all navigate.
Thank you all for sharing. I want to move on because Nate, you brought something up relating, of course, literacy to drivers. And actually all three of you touched on the social determinants and understanding how all of this relates to literacy and Reach Out and Read. I'd like to read an excerpt from one of Dr. Nate's interviews. Dr. Nate said, "Drivers of health are based on how we have structured opportunity within our society. They include things like housing, nutrition, access to employment, interaction within the criminal justice system, and education." Dr. Nate, would you lead us in a discussion about how literacy is indeed a social driver for health?
Yeah, and I really argue that literacy is a core social driver of health, given that it impacts your access to so many of the other social drivers. Because a child's early literacy skills really lay the foundation for how they will do in school, their potential for graduation, which then impacts their ability to get a job with fair wages and benefits like health insurance, access to loans and home ownership, the ability to mitigate the impacts of things like environmental racism. And then we also know that health literacy it impacts, so it's not just the ability to read and write, but how do you actually understand and navigate the health system and understand and take care of your own health. We know that if someone struggles to understand how to stay healthy or how to manage their own chronic disease, if they don't get clear communication with cultural humility, then they're at an increased risk of a number of complications like medication mistakes, increased hospitalizations, more missed appointments, and overall poorer health. And there's even a study that shows that basically the impact of limited literacy on your health is the same as the impact of a diagnosis of diabetes once you're in your older years. And so, we can really see that literacy is not, just one driver of health. It really impacts so many, and that we know that early brain development is this unique window to really lay that foundation to give our children the best opportunity to reach their peak trajectory.
Well, and
Ask
I
you
would
your
just
thoughts on this
add,
question as well, because you have a really unique perspective being at a nonprofit locally who gets to prep children to be ready for school, not only on the Reach Out and Read side, but others as well.
It is imperative that early literacy is a priority and that we are given the tools that are needed. So I think that people have heard children learn to read so they can read to learn. And without the ability to make that change so that the world is opened up to you, you run into all sorts of the issues that Nate's already talked about.
Thank you, Donna. How about Tasha?
yeah, what I was just going to add to what the doctor just mentioned is that low literacy rates, when I think about the fact that it creates a cycle of disadvantage, that's really difficult to overcome until that cycle is broken. And programs like Reach Out and Read, are helpful in breaking that cycle. So I can't say enough how important this program is for literacy. And as you discussed earlier, you think about how reading a prescription medication bottle or, understanding how many pills to take, when to take those pills, all of that shapes what you're in the understanding and your comprehension of that shapes health literacy into the future. One of the things we've done at Cherry Health is we focused on women, infants, and children. And really a key driver to that work was improving and enhancing the percentage of individuals that are breastfeeding. And the reason why we chose breastfeeding is because children that are breastfed have higher test scores. So you couple breastfeeding with all of the work that we're doing on literacy, we're giving children the best opportunity to not only, survive, but to thrive. And I think that's really important to us at Cherry Health from a local standpoint. And I'm sure, Dr. Mona would also agree that that's critical. I mean, you've got to set these kids up to thrive.
I think this is really important as well because we're talking about a trajectory, right? We're talking about this idea of setting children and families up for success. So when we really think about this trajectory of school readiness and literacy, collaborations are really essential. Dr. Mona, I know your advice to pediatric residents includes make friends and be ready to collaborate. What is one piece of advice each of you can give to us that will ensure successful collaborations for children?
I guess I would start, the most important collaboration we have to have is with the communities that we are privileged to live and work with. It is the parents and the children are our number one collaborators. And this has to be a very humble shoulder to shoulder partnership where we do this work together, where we are actively listening and being transparent and representative and responsive to their needs. I just want to make sure, and I struggle with this in our work. I just want to make sure that, we are not just asking parents to do more when we're not also addressing some of these underlying systemic inequities that make it impossible for them to take 20 minutes to read with their children at night. So our partnership has to be humbly with the communities that we are serving.
Yeah, I guess I would add to that and just say collaboration reduces duplication, which allows all of our resources to spread further to reach more children. So I think that we must be more intentional about, setting children up for success, as you said. But I think we've also got to make sure that we're leaving all of our agendas, all of our egos at the door when it comes to kids. And I think that we're getting better in our community at doing that. I think that, again, the Reach Out and Read program is a perfect example of that. Cherry Health is happy to partner with a program that has expertise in this area. And, I just think that each community has to really determine what's going to be important for children to thrive. And sometimes that means outsourcing. Sometimes that means you can't be the end all and be all in your community. Partnerships, I think, is, really where change really happens.
Thank you, Tasha. Donna, I'd like to move on to you. What are your thoughts on that, given your role at Ready for School, Reach Out and Read West Michigan, and those mutual thoughts of collaboration and confianza?
Well, community collaborations are huge, and they require that you look across not just the aisle, but across your sector. And we need to learn from each other. As Dr. Mona said, listen, but learn from the perspective of others, because people have such diverse perspectives, and that coming together, we won't duplicate, as Tasha said.
Dr. Nate, do you have anything to add?
Yeah, I would kind of echo everything that's been said, and then kind of also pass on what one of my mentors has really taught me is, when you're going into those situations for collaboration, really important to seek to understand before seek to be understood. Right. And so if you can really understand what someone else's goals are and what their pressures are, you can find ways forward together, I think, a lot easier. And one report in particular, when it comes to Reach Out and Read, I think does a really good job of this, is The Elephant in the Clinic, which was written by colleague Dr. Depesh Nafsaria and colleague Dr. Amy Shriver, the Reach Out and Read medical directors in Wisconsin and Iowa, so go Midwest. And they really did a great job using this parable of, the 6 men, evaluating an elephant and describing the different parts of the animal, but not seeing the other parts. And so it really kind of says that, Reach Out and Read is this early developmental screening tool. It's this way to be a literacy intervention. It's this public health intervention. And so there's so many different ways you can really package what Reach Out and Read brings to the table, that it can really meet the goals of various different potential partners. And so I think, really listening first to what they're looking for, and then kind of, tuning your message to make that path forward more clear.
Thank you all so much. I'm going to pass this off to Donna now.
Thank you for this rich conversation. I've learned quite a bit, and I have such respect for you. You are leading the way for our children, and the modeling the power of coming together for a shared purpose for the short term and the long term is really undeniable. So thank you. Well, this has been a fun lunch party, and it's been a party for a really serious issue. So I'm talking now to the audience. If you are compelled by the linkage of early literacy, the social determinants of health, and building equity from the very beginning, this collaborative is a place for you. We know and talked about the power of coming together. It's the alignment of multiple voices to ensure that all children and families have what they need to succeed and be ready for school. The American Academy of Pediatrics cites Reach Out and Read as the most studied and scaled primary prevention program to prevent gaps in readiness before they even occur. So, as a current or new Reach Out and Read provider, you will catalyze the improvement of all of the things that Nate and the panelists have talked about. In the 6 months to 5 year well child visits, when 90% of the brain is being built, you share a brand new, developmentally and culturally appropriate book with the child and talk to the family about reading. When the visit is over, the book becomes part of the family's library. The Reach Out and Read Kent County Healthcare Collaborative is open to anyone compelled by tonight's message. By joining, pediatric care providers will increase early literacy skills by modeling and prescribing reading. You will receive financial support, training, and ongoing quality improvement with special consideration for underserved children, as we've talked about tonight. By joining the collaborative as a community member at large, you will help guide this early work. For partners outside healthcare, training opportunities will be made available to you. And for partners interested in investing, know that though this launch of Reach Out and Read Kent County expansion is taxpayer fueled through 2021, sustained funding will require public and private investment, and we need to sustain it. So in follow-up, you can expect an email, the recording of tonight, and details about how to join the Kent County Healthcare Collaborative. And we'll also send you a short survey. Should you join the collaborative, you will be gifted with Scholastic's Book of the Year, which I think everyone on the panel has, Ruby Finds a Worry. This will add to your home or your organization's library. Through the work of Reach Out and Read, barriers to success are removed. We've heard that tonight, helping make Kent County more equitable and prosperous. On behalf of Kent children and families, thank you for joining us tonight, for your patience, and thank you for joining the work ahead, because we know ready children equals a stronger Kent County. Thank you.